Hi everyone. We'll discuss about the root canal anatomy of mandibular molars in this session. Mandibular molar, as you all know, there are 5 cusps in it. Mesiobuccal, distobuccal, distal, mesiolingual, and the distolingual. The average tooth length is 21.9 mm, and the pulp chamber has 4 pulp horns or sometimes 5 pulp horns, mostly corresponding to the 4 major cusps, except the distal cup, it corresponds to the other 4 major cusps, and correspondingly, we have pulp horns in it, in the pulp chamber. There is a floor, there is a roof, and there are 4 walls in the pulp chamber. The roof is rectangular and the floor is roughly trapezoidal in shape. In this picture, you can see A and E are the labial or the buccal view, and B and F is the proximal view. There are 2 roots, namely mesial and distal, with 3 canals. Mostly, mesial will have 2 canals, mesiobuccal and mesiolingual. Now, there can be variations inside the mesial root. There can be mesiobuccal and mesiolingual joining into one and exiting as one canal, or it can exist as 2 separate canals itself. In the F picture, you can see that the mesiobuccal and the mesiolingual is joining together to become one and exiting as one foramen. Whereas in B, there are 2 separate canals. So usually it is 2 well-differentiated roots with 3 canals is the most common configuration present in mandibular first molar. It is wide, the canals are wide and flat buccolingually. The distal is oval in shape with the widest diameter buccolingually, and is comparing to all the canals, this is the largest canal. The opening is generally located just distal to the buccal groove. The whole access cavity is present in the mesial half of the tooth. And if you prepare an access cavity like how you can see in the picture, you will get access to all the canals up to the apex. Mesiobuccal is right under the mesiobuccal cusp, and mesiolingual is present in a depression formed by the mesial and lingual wall, or slightly lingual to the central groove. And in mesial root, 2 separate canals with 2 exit is the most common one configuration, or it can join together. In distal root, it is usually 1 into 1, one canal, so exiting as one, exiting one foramen. We can also see that there are 2 canals exiting in 2 foramen, or 2 canals which join together to exit as one foramen. These are variations occur. The most common ones are highlighted in the slide. You can use the SLOB technique, same side lingual, opposite side buccal, to see the 2 different mesiobuccal and mesiolingual separately in a radiograph whenever you do the working length determination as well as the master cone radiograph. Avoid the over preparation, as anywhere you extend extra can cause perforation in the root as well as in the canal, in the crown. Now, comparing to mandibular first molar, second molar is more or less similar to this. Only thing is there can be some variations which we'll discuss now. The average tooth length is 20.4 mm. The pulp chamber is similar to that of the mandibular first molar, only that it is smaller in dimension, and the root canal orifices are smaller and closer together. You can see the pictures A and E labial view, whereas B and F is proximal view. The access opening is similar to as the mandibular first molar. Majority of the mandibular second molars have 2 roots with 3 root canals, but there can be variations of 1 root, 3 roots also. This tooth is very close to mandibular canal, so make sure that when you do the instrumentation, don't do over instrumentation, or don't push the intracanal medicaments or calcium hydroxide or sodium hypochlorite irrigant beyond the canal. The clinician must take care not to allow instruments or filling material to invade the space, because paresthesia may result. And there is one more thing what we have to discuss here, slight variation, which is C-shaped canal. The C-shaped canal was first reported in 1979. In this, how the anatomy is, all the orifices, the 3 orifices, can connect together with some isthmus region in between to form a C shape. It can be continuous, it can be, or multiple discrete canals in a C shape. It is most commonly seen in mandibular second molar, Cross-sectional morphology of the roots and root canals is a single ribbon orifice with an arc of 180° or more. Melton and Fan has given a classification for the C-shaped canal. As you can see in the picture, it can be just a thin strand of 180° or more, a continuous strand, or it can be separate canals also, with separate discrete 1 or 2 or 3 or even multiple canals in a C shape. We will not go into Melton and Fan's classification in detail. Just know that Melton and Fan's classification is for the C-shaped canal. Mandibular third molar, like in previous session, we have discussed that third molars generally have the maximum variations. You can't predict that it can be exactly 3 canals or 3 roots or in it. Whereas here, it can be 2 canals, 2 roots with 2 canals, 2 roots with 3 canals, or it can be even 1 root with 1 conical canal. It resembles the pulp chamber of mandibular first and second molar and causes many anomalous configuration. That's it for this session. We'll discuss the remaining variations and the comparison between permanent and deciduous in the next session. Thank you.